Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. I want to say thank you to Social Media Cowboys for sponsoring this week's episode of the Confidence Through Health podcast. If you need help with a website, if you need social media needs for your business, if you need help with AdWords, SEO, all those things that you know you should be doing, but you are too busy to do or you're too confused about, they are the experts that you need in your corner. If you're interested in launching a podcast, such as mine, they help me edit my podcast and do a fantastic job making sure that all of the technical side of it is handled and we launch a nice, neat, edited podcast episode each week. So I want to thank Social Media Cowboys for their continued sponsorship of the Confidence Through Health podcast. You can find them at socialmediacowboys.com, or you can find them as well with other sponsors at confidencethroughhealth.com. So thank you, Dr. Elahi, for being a guest on the Confidence Through Health podcast.
My pleasure.
And the thing that you specialize in is neurology, is the brain, which is, you know, when you think about it, that's the core function of having a healthy life is your brain functioning well, right? Like,
That's
okay,
right.
yeah, your heart has to be well and your lungs have to do well, all the other things, right? But like
Right.
from a truly happy aspect and experience in life, your brain has to operate well,
Yeah.
right? And there's so many things to that.
Right. Absolutely. It's interesting. You know, we have these arguments about which organ is the most important organ. And I can't say that the brain is the most important organ, but you know, without the brain, you're as we call it, a vegetable, right? You function, but there's no emotion, there's no processing, there's no function, if you will. And in fact, in neurology, this comes a lot as a topic because we see patients in vegetative state or semi-vegetative state in the hospital. And the question, of course, is should we continue supporting this person, this body, if there's absolutely zero chance for the brain to recover?
Yeah.
Which is a whole different topic. It could be a whole different podcast on its own, by the way.
Sure.
But yeah, I did a while ago, I did a YouTube very short segment about, I thought it was interesting, the life after death experience. And boy, did I get all kinds of feedback on this. It was probably one of the most popular videos about this, you know, seeing the light at the end of the tunnel. What is that? Is that a spiritual or a physiological function? And all I did was just discuss one aspect of that, which is there is some physiological evidence that when you have electrical disturbances in this particular part of the brain called the posterior parietal area, you actually see this, this feeling of being over your body and seeing light at the end of the tunnel, which is similar to what people have experienced with life after death. I got the most, I would say, quote unquote, negative feedback saying this doctor thinks it's all about science. There's no spirituality. I had no intention of doing that. But anyway, that brought so much attention, which is good. I guess it brought a lot of attention to the YouTube channel discussing these topics. So, yeah.
Well, and that is one of the things that the brain is, there's so many different facets of it and so many different pieces of it that can affect so many different things, right?
That's right.
Which makes neurology such a complicated, you know, I mean, like the saying is, it's like, you know, okay, well, it's not brain surgery, but you know, what you're dealing with is brain surgery, right? So
that's
like, it's so complicated.
Yeah, it is very complicated, and we still don't know a whole lot. Okay, let's be honest. We do know much more than what we did before, but we don't know still a whole lot. So there's a lot to be learned. But actually, this is very important because what we know now is so much more than what we did even a year ago. And you know, thousands percentage more than what we did 10 years ago. So, but a lot of even my own colleagues are still stuck in that old way of thinking regarding brain. So it's very important that we really update ourselves. I get articles every day in my email box about all the new findings.
Right.
We're going to talk about new technology and neuroscience, and it's just growing rapidly on an
Yeah.
exponential level. Probably the fastest growing field of medicine is neurology and neuroscience. I can
Right.
say that with 100% confidence.
Yeah. Well, and I mean, this wasn't necessarily a topic I was going to bring up, and I didn't, mention it to you beforehand, but I saw something about, Alzheimer's and the lesions and how this was what in the last week that they came out and said, oh, we've been approaching this all wrong.
Yes.
This is actually the thing we want to see, but we've been trying to get rid of it type of, scenario. And it's
Correct.
like, because it's such an evolving
That's right.
area, but it's also, you're trying to evolve with the fact that the
That's right.
body's trying to heal itself.
That's right. Oh yeah. And by the way, this is another topic too, but the body is very effective at healing itself. In fact, sometimes doctors get in the way
Yeah.
of the body healing itself, and that's a big issue. In fact, speaking of Alzheimer's, which is near and dear to my heart and what I do for patients, many of these big pharma driven medications honestly do nothing but harm.
Yeah.
And I'll be, you know, crucified for saying this,
Sure.
but invariably the medications, especially even the new ones, are in fact not very helpful.
Yeah.
So we could go into the more detail, but Alzheimer's is a big one. And
Yeah.
in fact, this beta amyloid theory that amyloid builds up, if you get rid of the amyloid, you'll be cured,
Right.
completely wrong.
Yeah.
In fact, these new infusion treatments that are being supported by big pharma, it does get rid of amyloid. You can see that on
Yeah.
these specialized scans.
Right.
Patients don't do much better.
Yeah.
They're the same. So I think it's an epiphenomenon. Yes,
Right.
it's a phenomenon you see, but it's not the actual root cause.
Yeah.
In my opinion, it may be involved, but it's not the actual cause.
Right. Well, and one of the other things that I saw recently, and my wife and I we were watching we like to watch the shows about, the Caribbean and like finding a beach house and those kinds of things. And and I guess we now fit the demographic that those show a lot of pharmaceutical ads, for people that are dealing with later, chronic stage
That's
issues
right.
in life. And it caught my attention that the ad said, this drug is for the people who are on this other drug and experiencing depression issues. And so this drug will counteract the side effects of the first drug that you're taking. And I was like,
right.
What are we doing?
That's right. Exactly right. And I know your viewers or your listeners know this for a fact. Doctor prescribes a medicine. That medicine causes side effects. Doctor prescribes yet another medicine to counteract the side effects of the first medicine.
Yep.
And this chain continues. So I'm a board certified neurologist. I've been practicing for 20 plus years. I know that. I've been taught. I used to practice that for many years. And it became very clear that there has to be a better way.
Yeah.
And so that's how I got introduced to, okay, let me look out there and let me talk to people around the world, around the country that use some of the newer techniques.
Mm-hmm.
And it was just a fantastic journey, still is.
Yeah.
And as you know, we'll talk about, for example, one type of treatment that I use a lot, which is TMS, transcranial magnetic stimulation.
Yep.
I tried it on my own family members, honestly, because I was so skeptical.
Yeah.
And I saw huge results in them. And then I tried it on my own patients, huge results in them. And that's how now I've been focused on these kinds of technologies.
Well, and that's you talked about the root cause earlier, right? And it's getting to the root cause. In, I've heard this with other medications, like, okay, well, you're not deficient in that medication, right? Like, that's not what caused your problem. Right. It's something else caused the problem. Like, go fix whatever else it is. And so the TMS, like in researching a little bit and what you're doing, like, that shows that it's addressing the issue at the heart of what's going on in your brain, correct?
Right. So, almost invariably patients come to our office, in any medical office, and say, doctor, I don't want to mask my symptoms. I want to resolve the underlying problem.
Right.
And for doctors, even for myself, that was a frustrating thing to contend with. How do you tell the patient, I'm sorry, I don't have the cure. All I can do for you is try to alleviate your symptoms so that you're a little bit easier.
Right.
And it's extremely frustrating. That conversation doesn't go well
Yeah.
in most offices, right? So that's one of the reasons I had to look elsewhere. And so in many ways, what I do is try to find the circuits in the brain that are causing the symptoms. And there are hundreds and hundreds of circuits in the brain that perform an operation. And when those circuits are not firing properly, you're going to have those symptoms. And in many patients, it's hard to explain that because they're having body pain, right? They're having muscle aches. They're having all these symptoms that relate to body symptoms, like actual like headaches or visual disturbances. And you go to the orthopedic doctor, and everyone says, but there's nothing wrong with your muscle. There's
Right.
nothing wrong with your joint. There's nothing wrong with your eyes. So it's the central processing unit. It's like I use the analogy of a camera. The lens of the camera is clear. The buttons work, but the film that captures the image is the problem. So you have to change out the film, put a new film in, or a new memory stick. Imagine if your memory stick in the camera is full, you're not, no matter how many pictures you try to take, it's just not going to record it, right?
Right.
Because even the lens is perfect. It sees. Your eyes can see very well. You go to the ophthalmologist, checks everything out, and he says, I don't know what's wrong with you. Your eyes are perfectly fine.
Yeah.
Because it's in the brain.
Right.
The brain is the problem.
Right.
And that's what's very frustrating. And then you go to a neurologist, right? Like the brain doctor, like myself.
Yeah.
He orders an MRI. MRI is perfectly normal. And then he's like, well, then I don't know what's wrong with you, because then they get shifted off to psychiatry.
Right.
Thinking, you're just making this up. You're just, and if you don't use the right tools, I use EEG technology, which looks at brain function. If you don't use that tool, how are you going to know? And MRI is just a picture.
Right.
It's like a dead person's MRI looks just like the same as a live person's MRI.
Oh, wow.
A heart a heart attack is not going to be something you're going to see with a picture.
Right.
You have to look at the electrical activity of the heart. Obviously, either it's going to be flat or it's going to be very arrhythmic.
Yeah.
So same with the brain.
Yeah. Well, and that's interesting, because I've heard people say, well, the MRI is fine, and so there's nothing wrong, but there's obviously something wrong because the person has changed their moods, their personality has changed over 6 months, which is not something like, if your personality changes over 7 years, 14 years, okay, you've become a different person.
Absolutely. And case in point, very famous person, Bruce Willis. You know Bruce Willis, right? Yep. Everyone knows Bruce Willis. He died from a condition called frontotemporal dementia. In the early stages of frontotemporal dementia, you're not going to see anything on an MRI. Yeah. The only way you're going to see changes is if you have a really good neurologist really picking apart minute details on an exam. And also, if you do some of the tests that I do here, quantitative EEG, functional MRI tests, which measure activity in the brain, measure electrical disturbances, then you're going to pick it up. But for years, you can go on and has very subtle symptoms. And he had actually not uncommon. Frontotemporal dementia is not uncommon. Yeah. It may not be diagnosed because a lot of doctors are not aware of how to diagnose it. Yeah. But anyway, there are variances to that too. Yeah. And it's a fascinating field and disorder. You start to have trouble finding words, and you can't find the words. It's just amazing. Yeah.
So for somebody out there who is like, okay, well, I'm seeing changes, whether it's in themselves or a family member or a close friend, right? Like, how do we know that that's actually, or maybe is it always something in the brain first before it's something else?
Yeah. So a patient this morning, this exact morning, asked me exactly that. Yeah. I showed her the brain map images, the EEG images, and it was, profoundly abnormal in certain areas. And she said, well, is it my brain that caused that, or that my body had these symptoms which led to the brain abnormalities, the chicken or the egg, right? Yeah. Well, that's where the clinician, the doctor, is really supposed to take their time and listen to your story. What came first? Give me the chronological order and detail of what your symptom, how your symptoms started. If you listen to the patient carefully, you can start to see patterns. This patient started to have genetic abnormalities that started early on in life,
Yeah.
and then she started to have other symptoms later on. And they teach you this in medical school, but no one pays attention to it because of various reasons, which I can get into.
Yeah.
But they're not taking their time to listen to the history.
Right.
The patient will tell you exactly what's wrong with them. If you just listen, it may take 5 minutes, it may take 25 minutes, it may take an hour, but they will tell you. And so that's how you're going to know whether it was a chicken or the egg.
Yeah.
Because if there's a history of prolonged symptoms that date back X, Y, and Z and can be explained by these abnormalities in the brain, and then you have the laboratory tests that were done, the workup that was done. What does that tell you? So a good doctor will listen to the patient, put the history together, and then use the tests to help identify the suspected diagnoses, not the other way around.
Right.
The problem is that within health insurance, you have 5 minutes to see the patient.
Yeah.
I don't use health insurance. I used to.
Yeah.
I'm out of network with insurance. I take a couple hours if I need to.
Right.
Then I sit down and listen, and I think about it. What else can I be thinking of? That's impossible in the vast majority of medical offices.
Right. Yeah, there's just not enough time to get down to that nitty-gritty, and so you're guessing at that point at, okay, well,
right.
80% of people that say these things, it's this, and so we're just going to go with
that's
that.
Right. I mean, honestly, most of us, because if you practice enough years, within 5 seconds, literally, you can tell where the patient is going and what kind of symptoms they're having and what likely diagnosis is. But that can get you in trouble because, yes, you may be right 80% of the time, but that 20% of the time, you're going to be wrong and you're going to miss it.
Yeah. And so for somebody, like I've heard this before when it comes to the chronic diseases like dementia, Alzheimer's, that those things are, they're developing decades before. And then you get to a point where you tip the scale, right?
That's
you tip
exactly
the scale,
right.
and then all of a sudden now it's so when you tip the scale, is it your brain is now functioning at a level that it can't come back from?
Exactly right. So yes, decades before the onset or when it becomes obvious, you start to have some symptoms.
Yeah.
But there's a very important issue here. Just because you're having memory issues doesn't mean you're going to have Alzheimer's. And this is a misconception. Alzheimer's is a multi-faceted disease that affects not just your memory, but all kinds of other types of brain function,
right?
Personality, visual, spatial, all kinds of stuff. And yes, while it can start the years before, it often can be anxiety provoking because many younger patients say, oh my God, I'm having memory issues. I'm going to have Alzheimer's.
Yeah.
That is simply not necessarily true. I actually published a case report of a very young onset Alzheimer's, where rare, extremely rare. She started having issues in her 40s. And I thought she had, I was convinced she did not have Alzheimer's because who has Alzheimer's in age 40s?
Right.
It's very rare. And then we started doing some specific blood biomarkers and specific tests, and absolutely she had Alzheimer's. And it was very interesting because she actually responded to TMS. Yeah. We were doing TMS thinking she was just depressed. And then she started showing improvements in her memory. And then when we did the blood tests and the biomarkers later, after we had already done the TMS, we found out, oh my God, she has Alzheimer's all this time.
Yeah.
And then lo and behold, she actually improved. So that was a published report in the journal called Clinical Neurophysiology. And it was just very, very, very interesting.
That is interesting. And it shows again that in-depth, like, discovery that needs to happen.
Yes,
by the
absolutely.
clinician, that it's like you can't just because you could have, I would assume you could have easily said, okay, she's starting to see improvement. We're just going to let things go.
Correct. Exactly right. So we have so much technology nowadays. There's biomarkers in your blood that can identify whether you're at high risk for Alzheimer's, but it has to be done in the right setting, meaning you have to have the right picture and the right exam and the clinical history, because if you nilly-willy order these tests, they're going to be wrong in many, many cases.
Yeah.
I have a YouTube video on that too, but there's so much technology now.
Yeah.
And unfortunately, our healthcare is dominated, one, by big pharma, and two, by big insurance.
Yeah.
And insurance is a for-profit organization. They don't care whether your health is doing better or not. They care how much it's going to cost them, period. And so why would they cover these services? Because it costs them less to cover these services than not to cover it, except they don't find out until they have enough data by their accountants, and it may take years for the data to build up, and they realize, oh my God, we could save so much money if we just did this.
Yeah.
And that's the problem with our healthcare system.
Right.
It's ravaging the entire system, big pharma, big insurance.
Yeah.
If you really want to get good healthcare, you basically say, forget all this. I'm going to look out for my health and basically go to a doctor that's going to take his or her time. He's not worried about whether insurance is going to cover this or that.
Right.
And those are rare. We're trying to pioneer that.
Yeah.
But it's very rare because it's economically very difficult and challenging to do.
Right. But so speak on, because if I remember correctly, I saw you talked about this a little bit in a YouTube video, the difference between, okay, this is depression because the brain is truly, something's disconnected, something's not functioning properly, versus, okay, this is depression, I need to go talk to a psychiatrist and work through these issues.
Excellent point.
That can be different, right?
That's right. So first off, depression is a man-made diagnosis, right? It's they sat together and created this book called the DSM.
Right.
And they said, okay, if patient presents with these symptoms, they have X.
Right.
As a neurologist, that was not very satisfying. I said, I need to see like physiological changes, what's happening in the brain.
Yeah.
And I actually, even as a college student, I started studying these disorders. There was a family who had depression in the entire family. And I tried to find what is it common in their CSF? What is it that's happening? And then now, fast forward to now, we now can see specific patterns of electrical activity involving the prefrontal cortex in the front, how it connects to the cingulate gyrus in the center of the brain. I don't know if viewers who watch this episode or they're just listening to it. But anyway, and you can see specific patterns that can say, yeah, this patient is likely suffering from depression.
Right.
That's one way of diagnosing it. Sometimes, due to other causes, patients feel stressed or maybe even meet the criteria for depression. But when you look at their brain physiologically, it seems like it's okay.
Yeah.
And those patients often get better with psychotherapy. But the patients who have a very deep physiological abnormality, no matter how much therapy you do, you still have to correct that physiological abnormality in the brain.
Right. Right.
So this is a relatively controversial topic. And it's, again, because, Galileo was crucified because he said the earth was round.
Right.
And the sun doesn't go around the earth. Earth goes around the sun. Yeah. We're kind of in that same era with medicine. Yeah. We're talking about things that a lot of my colleagues are thinking it's heresy. But it's actually grounded in very concrete science.
Yeah.
So to your point, to answer your question, yes, there are patients who have very clear physiological markers of quote unquote depression. Namely, there is an abnormality in the dorsolateral prefrontal cortex and its connection with the cingulate gyrus. It may be also involving other areas in that circuit. And then there are patients who are stressed from life stressors. And so it's really good. It's really fascinating to see these changes. And
Yeah.
sometimes you need a functional MRI to see it. Sometimes you can see it on a cheaper version of that called a quantitative EEG. And there's still discussion among the neuroscientists in the field as to whether these are actual true patterns, or are we just kind of hallucinating.
Right.
But it's very, very interesting.
So for a person that presents with that, and you can see the physiological issues, TMS is something that is it forcing the brain to rewire?
Good question. So what is TMS and how does it work?
Yeah.
So TMS stands for transcranial magnetic stimulation. And basically you're using a very known basic law of physics. You pass electricity through a wire, it creates a magnetic field. That magnetic field will induce an electrical charge if there is a wire next to it or if there is ions next to it, right?
Mhm.
So the brain is full of ions. It's all salt,
Yeah.
water, and it's always conducting like a battery electrical discharges. So when you pass electromagnetic pulses in a specific area of the brain, it triggers a discharge of electrical activity. And I use the analogy of, you know how when someone's having a heart attack, they come in and put these paddles on the chest.
Yep.
And they induce a whole heart electrical discharge.
Mhm.
What that does is resets the electrical nodes in the heart to establish again a normal rhythm.
Right.
We're doing a similar kind of thing, but in localized pinpoint regions of the brain.
Okay.
It's resetting a normal rhythm to electrical frequency that was not working properly. So,
right.
So that's one mechanism, resetting electrical discharges. Number two, it's been shown that actually you increase the release of neurotransmitters. Everybody knows what neurotransmitters are now.
Right.
It's releasing things like dopamine, norepinephrine, serotonin, and it's basically increasing the secretion of those neurotransmitters in that area of stimulation.
Mm.
Three, studies show that there's better connectivity between different regions of the brain.
Mm.
So if Elon Musk wants to make a car, he has to get sheet metal from some other country. He has to get chips and batteries from another country, put it all together in a factory. Right. That's how the brain works. It brings in information from one area of the brain, connects it with another area of the brain in order to perform a function. Right. Those highways have to be working properly. Mm-hmm. If freeways, roads, and airways and shipping patterns are not working, Elon Musk cannot make a car, right?
Right. Right.
So same thing with the brain. So it strengthens and clears those pathways. In fact, for Alzheimer's, since you mentioned that, studies show that TMS releases the toxins, if you will, the amyloid toxins that have built up. Mm-hmm. And studies show that basically these channels that clean the brain parenchyma, and they're called, there's oligodendrocytes and there's different cells that work as a cleaning function for the brain. It basically charges them up, meaning it increases their activity. So you see, in fact, here's a groundbreaking thing that not a lot of people know about. We're about to publish some of this. Mm-hmm. When you do TMS on Alzheimer's patients, after you do TMS, those blood biomarkers normalize. So you measure their blood biomarkers before, and this is just blood. You can't argue with blood samples. Right. You measure it afterwards. The blood samples show an improvement in the biomarkers.
Wow.
Right? Which is amazing. The explanation for that is, because you're triggering more vascular cleaning of those toxins out of the brain. Right. And every patient that I've treated with Alzheimer's or with precursor to Alzheimer's, we do the biomarkers before, we do it after, it improved. Yeah. And the big pharma guys want you to, get these huge infusions to establish the same thing.
Sure. With
the risk of stroke and even death from these infusions. We do the same thing with brain stimulation.
Right. So you said a couple of things in there that I sort of want to touch on, but like unpacking that like is just you're truly you're jump starting the brain to say, oh wait, let's go fix ourselves. Right. Let's and that's something that I know is And I can see the correlation now of somebody who is dealing with, whether it's depression or whatever other, like, just brain function that's not working well. So they're just not feeling themselves. They're not
Correct.
feeling right.
That's right.
And so they're like, okay, well, I need to clean up my diet because that's going to help. I need to sleep more because that's
Yes,
going to help, right? Those
that's right.
things help. But if they don't address the fact that something's broken,
Correct.
farther up the system.
That's right. So this is very important. There's no one is saying that you should continue eating poorly
Right.
and that you should never exercise and just do TMS, you'll be fine.
Right.
Absolutely not.
Right.
In fact, if you don't do those things, it makes it harder for these treatments to work as well. So, and there's a higher likelihood of relapse when you're eating poorly, not getting an adequate amount of exercise. But some out there may believe that we can cure everything with diet and exercise. It's just simply not true.
Right.
In my opinion, you can't just fix everything by eating well. And I have patients who've done everything in their power for years.
Yeah.
They exercise, they eat really super healthy. And you look at their brain, it's still having those abnormalities. And when we fix those abnormalities, they're just far better.
Yeah.
In many ways. And then I have patients also who do well with, fixing their diet and exercise. They feel better. And sometimes it goes back to your earlier question, which is there a physiological abnormality in the brain or not? If there isn't, you fix those issues like diet and exercise, you're going to feel much better.
Right.
But if there is a physiological anomaly, you need to fix that.
Yeah. And then to the, I think everybody's heard of the blood-brain barrier.
Yes.
And things that are not supposed to get in.
Correct.
And so those toxic materials that get through that are not supposed to be there, right? So is that part of the TMS is helping clean that stuff out because it's getting the brain to go, oh, let's flush this out.
Yeah, exactly. It's literally flushing a lot of these toxins out because again, there are cells that are dedicated to cleaning up the brain. And that's why there's a blood-brain barrier, meaning the blood vessels, the walls of the blood vessels do not allow all chemicals to exit through and enter the brain space. It's very protected. The brain space is very protected, but eventually some of those toxins do make their way into the brain. And what TMS often does is it increases the vascular outflow of those toxins. And that's been clearly shown on very nicely done studies. And in many ways, that's why a lot of people think it helps with Alzheimer's because it literally cleans out some of those toxins and protein buildup that has led to aggregates we talk about and brain dysfunction.
And then, and sort of like you said, with the healthy eating and exercise, like you can do all that stuff, but if the stuff's already roadblocked and in the way, that's not enough to get it to move.
Correct. Exactly right.
It's got to be some other stimulus has got to come in and say,
correct. Okay, and there's work now with that's what all these infusions are trying to do. They're trying to basically, they have monoclonal antibodies. They have antibodies that attack those molecules, those toxins, and the body tries to use the immune system to clear them out. Well, when you activate the immune system, it's also going to be attacking normal tissue.
Yeah.
You've heard of the virus, the vaccine-induced autoimmune reactions?
Yep.
It's exactly the same thing.
Yeah. So,
yeah, you just woke up the immune system, but it's not only attacking the bad stuff, it's attacking the good stuff. Right. So you get a condition called ARIA, amyloid-related inflammatory changes that cause white matter abnormalities.
Yeah.
And that's a huge disaster. Why introduce a substance that has even the slightest risk of causing an autoimmune reaction, white matter disease, and stroke without a clear, robust, groundbreaking benefit?
Yeah.
It's just amazing. The panel of experts that was hired by the FDA to approve or not approve these drugs all said no and resigned.
Yeah.
In in protest because they all said no. So why did they improve it?
Yeah.
You know what the reason was?
Yeah.
The reason was because we have nothing better.
Right. Yeah. Well, but there are so many things that are better, and there's so many things that can work in tandem with, like we talked about, the body's own ability to heal itself.
That's right.
Right. It's just give it the stimulus that it needs.
Correct.
That most of the time can be non-pharmaceutical.
Correct. Exactly right. Absolutely. I mean, Dr. Bredesen at UCLA has written books on the diets that you want to follow, all of which is really good.
Yeah.
And so you have to really pay attention to that.
Yeah.
The body, going back to what you said earlier, is able to heal itself in many, many ways. In fact, in medicine, all we're doing is allowing the body, we're supposed to be allowing the body to heal itself. When you go to the hospital, let's say you have an infection, we're giving you antibiotics. The antibiotics only basically attacks the cell walls of the bacteria, but the body still has to do all the healing of the injured organs.
Right.
So it's an amazing with evolution having developed, hundreds and hundreds of centuries of how to repair itself.
Right.
And if you can get out of its way, it often does.
And so with that thought process in like repairing itself and healing itself from a longevity aspect for people, because I know a lot of people, they'll say, oh, well, I'm 41 now, this is going to start breaking down, or I'm 60 and now, oh, well, I can't, I've got a relative who's in their 90s, and I remember when they were in their 80s and they're like, don't get old, it sucks, and I'm like, I don't think it has to. In the brain, everything ages, but it doesn't have to necessarily like fall off a cliff aging, right?
Exactly right. So there's a lot of misconceptions, as you're alluding to regarding aging. I think what we often miss or forget about is that your environment is also changing. So, for example, I have a 5-year-old and a 6-year-old.
Yeah.
When they were born, I was not sleeping as well as I was before. Right?
Yeah.
When raising 2 boys is going to be tasking.
Yep.
So I have to be even more careful now about my exercise, my diet, because when you're stressed raising kids, last thing you want to think about is about you.
Yeah.
And, I've gained weight. I used to exercise 3-4 days a week, play tennis. I haven't been doing that. And yes, I'm aging as a result of that.
Right.
So I see people who, have less stress and take care of themselves, and they don't age as much. So the circumstances around your life play a big role as well. It's your job to try to resolve those circumstances and find ways to adapt so you can continue the de-aging process.
Right.
And that's very important.
And so sort of last topic I wanted to hit on was, because I know a lot of people think about brain function and think about the mind and how the mind works, right? And of course there's people that think, oh, the brain is separate from the mind, and so it's like they don't like, but if your brain is functioning well, your mind's going to be better.
Yes.
That's pretty basic understanding.
Absolutely.
Right?
Absolutely. Yeah, I mean, I really don't see a distinction between the mind and the brain. So in fact, they often say psychiatrists work with the mind and neurologists work with the brain. That's nonsense to me.
Yeah.
It's all related to the brain, how it's wired, all the physiological changes. And then going back to that one video that I made about the end of life experience, this argument about spirituality versus neuroscience, I think it's all the same. Spirituality is a very well-defined part of our lives.
Yeah.
But it's also part of neuroscience.
Right.
I don't think there should be a distinction between the two, but many argue with me on that.
Yeah. No, I mean, I think everything's connected. And I think, and another thing I think that you've mentioned this multiple times, both with the brain, but your analogy of the heart, and like there's a piece of us at the core that we're an electrical being.
Yes.
And if we don't keep those electrical currents working,
That's right.
then, you start a fire, which is then inflammation. And
That's
then,
right. Exactly. And I think where people get offended is when scientists and others talk about, waves and electricity,
Mhm.
they think that wrongly, in my opinion, that they're dumbing it down to just atoms and plus or
Mhm.
minuses.
Right.
It's not. There's no dumbing it down. It's very complex,
Mhm.
and we will never know the exact nature of everything.
Yeah.
It's like the question: is there a God? Is there no? I mean, what? That's like it's just so uh, exhausting
Yeah.
to even want to talk about that.
Yeah.
Of course, there's spirituality.
Sure.
Spirituality is part of the brain.
Yeah.
The brain, and there's so much that we don't know. So no one, in my opinion, should be dumbing it down to anything necessarily.
Yeah.
And there's a lot that we don't know. But you've heard of the heart-brain connection, right?
Yeah.
People have a traumatic experience, maybe a death of a family member, and their heart starts to go,
Yeah.
and their mind starts to go, because there's a direct connection between the emotional parts of the brain and heart. There's literally a direct connection. And if you want, I can show you the anatomy. It's from the cingulate gyrus down to the hypothalamus, or the brainstem, the hypothalamus. It connects. So there's a direct connection between the mind and the brain. So, yes, there is a broken heart syndrome.
Right.
I think perhaps it's much easier to think of it that way than having to learn years of neuroscience, read all these books, and learn about this and that. It's just harder to do that than to say, hey, there's a spirit. Of course, there's a spirit.
Sure.
We're trying to define that spirit in terms of neuroscience.
Right.
We're not doing anything wrong. We're just trying to define it.
Right. Well, and in thinking about that, if your brain is working from a functional standpoint better, in my opinion, you have a better ability to feel that spirit and feel
the spiritual
side, because and that's all the different biohacking things from a health standpoint, but there's times where I know if I'm not stressed by environmental things, or life in general, or my teenagers, or then that connection can happen and life gets more peaceful.
Absolutely. Of course, everything is about perception. And perception, again, is part of the brain. There are people who have amazing lives, but they're fully depressed.
Yeah.
They have people, and then there are people starving lack of nutrition, and they have the most beautiful experiences and emotional stability.
Right.
So it's about perception and your upbringing and how your brain was wired, and genetics. Genetics plays a huge role.
Yeah, very true.
So it's not one thing or the other. It's a complex series of facts and elements that are playing a big role in all of this.
Right. So how can people, you've mentioned your YouTube channel a couple of times, how can people find it, follow along, subscribe, all of that stuff, and stay involved?
It's a funny name. It's called NeuroSpa Brain. So if you click on NeuroSpa Brain on YouTube, you'll go straight to that page.
Awesome.
NeuroSpa Brain. It's hard to spell this. NeuroSpa. NEUROSPA. Why NeuroSpa, the name? I don't necessarily like that name. My wife came up with that name.
Okay.
We're not a Medi-Pedi. We're not it's a neurology office. Yeah. But she thought it would be nice because it's not your typical neurology office where we're just dispensing medications.
Yeah.
We're not doing massages. We're not doing manicures or pedicures, but it's called NeuroSpa.
Yeah. Well, I can see the connection if you're hopefully coming out feeling a lot better.
Yes.
Right.
And by the way, there's no 100% in life. There's no 100%, especially in medicine. but the vast majority of our patients do well because I don't stop until they do feel well. If they're not responding to X, I do Y. If they're not responding to Y, I do Z. I don't give up until I find a solution for them.
Right.
And we have over 90% success, to be honest with you. And because of that.
Yeah.
And we don't wait for insurance to tell us what to do.
Yeah.
We help patients get reimbursed through insurance. We make our services as cost effective as possible, but we're not dictated by big pharma or big insurance.
Right. And that's, like you said earlier, it is hard to find. It is hard to find people that are willing to do that, because the time involved versus the cost versus, and especially when it's something like the brain, because there's so many different levels and complexities and pieces that are working together.
Right. That's right.
To try and put that puzzle together of where is the roadblock that we can fix.
Yeah. I had a patient who traveled several hours of driving. We have patients, by the way, from all over the country. We have patients from all over the world. But anyway, this one of our first patients here at this office brought his daughter from many, many hours away.
Yeah.
And the reason they came to us because they couldn't find a neurologist that was open, that had availability.
Yeah.
He came to us. He was desperate. He said, "My daughter's having seizures. I don't know what's going on with her." I did an evaluation, ordered the MRI that same exact day, did an EEG, found out she's having epileptic seizures from multiple tumors in the brain. We sent her to the hospital. She got surgery that week.
Yeah.
This would have been impossible with insurance.
Right.
You had to wait to get approved for this and that. She would have been not in a good place.
Right.
If it was due to done with that health insurance. Her dad, years later, called me and couldn't be more thankful about the process. And literally, even with costs, his costs was far less than if you count the deductibles, co-insurance, premiums that you pay insurance. Insurance is not a cost-effective way.
No.
Many patients are misled to believe that if you have health insurance, you're going to save money. Absolutely not.
Yeah.
I personally don't have health insurance, and that's a big heresy, right?
Right.
Because I calculated by the time I pay my premiums, my insurance copays, my co-insurance, my deductibles, I might as well negotiate with the hospital and get a nice cash rate.
Right. Yeah.
Which is exactly what they do, by the way.
Yeah.
They're just collecting money from you.
Right.
But they scare you into thinking, what if that one day, Joe Schmo, you have X? Well, here, you should just pay us for 30 years for that one day.
For that one day. Yep. Yep. And the time from getting in, because I know that I talk to doctors here in where I am in Waco, and the time to get in to see a neurologist, it like sometimes it's 6 months or more.
It's 6 months or more, yeah.
And it's like, are you kidding me? This is it's not like, a toenail that needs to be looked at. This is your brain. That's like,
that's right.
I mean,
exactly right. Exactly. I used to be that doctor, right? Back years ago.
Yeah.
I stopped because it was just like, I either was going to quit and do something else, or do the medicine the right way, the way it's supposed to be practiced.
Yeah.
All my colleagues thought I was crazy. Are you out of your mind? You're not going to take insurance. You're going to do all this stuff that no one knows about. Yes, yes, yes. And that's where I am for the last 10 years.
Yeah. It's awesome. Well, I want to thank you so much, Dr. Elahi, for being a guest. It's been a great conversation.
Yeah, my pleasure. And it was great seeing you as well. And thank you for spreading the word.
You got it. Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.